Hello, and welcome to another edition of Oracle Health Inside Access, a monthly touch point where we demonstrate our commitment to refining our current solutions while pushing the boundaries of innovation. Thanks to all who joined us last month for our kickoff. We received tremendous feedback and a number of questions that we answered live and some that we continue to address through our field teams. Let's keep the dialogue going. As people continue to trickle in, I just want to remind you all that we have folks on the call today behind the scenes to answer your questions. So please be sure to add your questions in the Zoom Q&A function. Today is all about data and how it can be leveraged to not only deliver high-quality, personalized care for individuals, but also to scale data to care for entire communities. As a clinician and the Chief Health Officer of Oracle Health, the value of data in healthcare is a topic that's near and dear to me. Nearly 2 decades ago, when I started working as a hospitalist, caring for acutely ill patients, it was really difficult to discern the quality of care we delivered for our patients. In fact, to obtain data on our care, I had to request charts from medical records, a large room in the basement of the hospital where all the patients' paper charts were kept. I remember this one time we decided to improve our prevention rates for deep venous thromboses. Now, deep venous thromboses are blood clots that can form in patients' legs when they are bedbound in the hospital and not moving around. These clots can actually dislodge and enter the lungs, and in extreme cases, stop the heart from working. Thankfully, there's a simple solution. There are blood thinners that providers can prescribe during hospitalizations to prevent blood clots. So my team and I were going to assess our performance in prescribing these blood thinners for patients in the hospital. I remember going to the basement with some medical students to carry over 100 paper charts to my office so that we could leaf through thousands of pages of medical records and manually extract if patients had received blood thinners during their prior hospitalizations. Based on past performance, we designed processes to try to improve our future performance. Thankfully, with the transition to electronic health records, we were able to have real-time access to health data. For the same initiative, we were able to identify in real time the patients in the hospital who needed blood thinners. We now had clinical decision support to figure out the most appropriate blood thinner for each patient at the right dose, and decision support to manage complex situations, like when we needed to stop the blood thinner prior to surgery or a procedure, and when to restart it. As a result, thousands of patients who would have previously fallen through the cracks received evidence-based care. And as a result, patients did not have to suffer from blood clots in their legs or worse complications. Data-driven healthcare has transformed care by personalizing treatments, optimizing outcomes, and fostering innovation, ultimately saving lives. To continue our conversation about the value of data in healthcare, I'd like to introduce my colleague and good friend, Nino Bice, Vice President of Product Management AI for Oracle Health. Nino?
Thanks, Nasim. That was great. Hi, everybody. My name is Nino, and I'm a member of the Health Data Intelligence team here at Oracle Health. If you're an existing customer, you would know this body of work as the Population Health Platform. The Health Data Intelligence team builds end-to-end applications and solutions to operate health networks. Let me take you through in 4 basic pillars what that means. Number 1, we will continue to build a deep investment in our ability to store and understand all health and patient data, regardless of the EHR or the applications you use. Second, we'll build applications and services that continually help you understand your population, organize them by chronic disease or other categories, see the risk, and then go into the next pillar, which is what is the right coordination and set of actions you need to take on that patient or cohort of patients that will either be reactive or preventative. Lastly, we'll continue building a pre-built and extensible set of analytics that allow you to measure success, and they're scenario ready. So whether you're running a small community hospital, an ACO, a SIN, it's fully scalable end-to-end. How we measure success is on these following 5 KPIs. Number 1, how many new patients are you reaching, identifying, and acquiring? So we build a bunch of software to help you think about, dimensionalize, and perform outreach. Second, the number of increased screenings that you have to do daily, weekly, and monthly to meet your effectiveness goals and your efficiency goals across your population. Third, the number of gaps closed and the screenings that you're providing, especially with high-risk populations, that allow you to meet your goals and to keep people healthier. 4, your increase in utilization. Is your team being effectively utilized, doing the right things for you to close the care gaps on time, deliver effective care, and to increase the efficiency of how you operate so you're effectively doing broader reach at less cost? Lastly, the percentage of risk and reimbursement. If you're in a value-based arrangement, how are you doing? How are you performing? Are there certain things you can do to manage your risk profile? Also, is your team following the things you need to do to make sure you reach maximum reimbursement, regardless of the business model that you're in? Now, let me take you through the set of services and applications that we build in Health Data Intelligence. The first one is population management. This is either a web-based portal or an embedded control that helps you understand your patient population, organizes them by cohorts, and associates risk scores. Second is our care management applications and services that allow you to understand the folks that are at high risk and need care and attention, coordinate their care, perform outreach, make transitions, and see referrals through. Third is our regulatory management body of work. This is what keeps your system running, keeps you compliant, keeps you regular, and keeps readmissions coming in. This is an application that models all of the information and surfaces them to you in an easy web-based way, or again, embedded into an EHR. And lastly, our analytics. Continually updated, purpose-built analytics from a range of benchmarking to cost and utilization to measuring clinical quality. All available to you and your team through a simple web-based interface or embedded directly into your applications. One thing to keep in mind here is today you'll buy these as parts. What we continue to hear from our customer base is that you'd like all of this in one box. Now, in the months ahead, and we'll talk more about this, but we are thinking deeply about how to deliver all of these capabilities to you in a predictable way with a very easy, predictable way to pay for it. And we'll follow up more as we go. Now, let me take you through the stack that powers all of these intelligent applications. Underneath those applications, and this is what we mean by building intelligent applications, is a very large investment that we're making in services. So if you look across that middle row, you can see examples of what we call intelligent services. A registry is an intelligent service. HCCs are intelligent services. How we associate risk on a patient and what the next best action is an intelligent service. Care plans that work specifically for a patient. How do we make sure coordination is working? Are we suggesting a clinician that speaks the right language, has success with that specific patient's situation? Those are all intelligent targeted services. Of course, we build, maintain, and continually update a longitudinal patient record. We have ontologies and the latest and greatest data models that you just come to expect, built in and continually updated. And as we'll show you today later in the talk, we're even taking our intelligence services further this year, and we're going to introduce things like summarizing the longitudinal record to accelerate care management automation. Now, if you follow me down to the next layer on the stack, these are the core lifeblood of our whole platform. So we continually ingest, model data. We have a whole team of clinicians that are building regulatory standards. When standards are published, they look at them, they design, they build, they get them out to you into your application services and workflows, and we'll talk more about that. We have scenario-ready analytics. So again, whether you're running an ACO, a SIN, or just enterprise analytics, They come pre-built out of the box for your team to deploy and get them running the next day, or you can hit File Edit and go create and customize all your own BI to fit your specific scenario. On the right, and something we'll even go deeper in today, is our intelligent authoring platform. So, for example, you can get at any of the data models, the semantic models, or any of that intelligence, and you could extend these capabilities, customize them, and put them right back into application workflows. And we'll tell you how. Now, as you'll hear, is we're bringing this entire platform over to the Oracle Cloud. What that enables us to do is fully integrate all of these services and all of these tools into a unified intelligence framework. What's really important is everything you're doing in the dark blue layer manifests and gets published into the application layer at the top. So for example, what does your population data tell you about the flu trends going on in a specific region? And how should that inform the supply chain decisions that you and your team need to make? What does that say about the staff you need to have on hand to go administer that flu campaign or to run an annual wellness campaign? These capabilities are now all connected, and this is very unique to Oracle Health, and we'll talk more about this. Let's take a little bit of a deeper dive into what we mean by integrated intelligent applications. For example, when you're your team, let's say you're a leading pediatrician in the Southern California area, just for example, and let's say that you know specifically, you and your team specifically know what to look for when you see a patient with a specific situation in a specific scenario, and you want to capture that intelligence, whether it's a simple rules, whether it's something like analytics, or whether it's actually machine learning that's going to recommend a next best action. We're going to make it easy for you to take those capabilities. Again, you don't have to be a data scientist. Wire them up, define the model you're looking for, define the situation, the outcome you want, publish it, and put it directly into, for example, a clinical workflow. So imagine your team, somewhere else in your team in your department is seeing a patient. They're in diagnosis insights inside of Millennium, and they want to see a recommendation. They're treating a pediatrics patient. They see that recommendation has come from the team in the department. So those are very basic examples of this flywheel that we're going to continually invest in and continually think about, so that not only do we capture and build intelligence out of the box, but you and your team, everyone from the clinicians to the care and quality management team, to maybe even the office of the CFO or the chief pop health officer, can also leverage their subject matter expertise, capture that intelligence, put it into application workflows, see how it's doing, and then that whole flywheel starts over and over again. We are the only major cloud that can bring all of these capabilities together, and this is a major reason why we're vertically integrating onto our own platform. So let's do a little bit of a deep dive into what we mean by the back office. And you'll hear us say these things over the next coming months. When we think about your back office, we think about, go back to that supply chain I gave you. So if you and your organization have things like Fusion supply chain management, or the ability to do human capital or staffing management, or have our advanced capital expenditure and cost management tools, you can now connect those applications with all of that breadth and depth of signal that we capture today with the Oracle, the data intelligence platform, specifically in our data store. We understand everything going on in your network, regardless of whether you have 1 or 5 EHRs. When these worlds come together, like I was saying earlier, you can predict what's going to happen in your patient community. You can predict the supply chain you need. You can see the staffing you need to have on hand, and you can have amazing cost transparency and cost controls so that you can go make the adjustments you make, that you're spending capital the right way and you're doing the right allocation in your resource planning. These things are not future things. They exist today. Feel free to contact your local account team and we can get started. We have customers building these today. We're excited to drop teams off and see the magic of these two estates coming together. Let's take a look at the things we've built in the last 8 months and we've shipped and brought to market. So we're very proud of these things. We'll continue building, we'll continue shipping, and our velocity will only get faster over time. So for example, in the regulatory and quality reporting space, we've made the incremental updates that you would have expected in the last 6 to 8 months to be compliant with the latest industry regulations and standards. We've brought those to customers. We've got them in your hands and you're driving your current reporting year. We've released a number of new improvements, like, for example, in care management, we're optimizing the billing workflows for care coordination. We've done a slew of investments in the provider portal, if that's something you and your team use. We've continued to advance filtering and targeting for referrals so they get better. And again, this is all related to more customized, personalized, contextual recommendation and coordination services. Now, under the population health analytics team, slew of updates from episodes of care analytics to more benchmarks to more third-party grouping. And you'll see those continue over time. If you have not been able to deploy these improvements into your team or with your system, reach out to your local account team. They'll help you get started, will help you demo, and will help you build to realize the value of these capabilities. Now, lastly, on the right, we continue to invest in the data service, and we've done a lot in the last 8 months. From operational excellence, that service needs to be incredibly secure and stable and scalable. We continue investing in data acquisition technologies to make it faster, and the time from the data gets written somewhere to now it's a longitudinal patient record will come down orders of magnitude. Data quality. We continue making investments to make sure that you understand the data that's in there, you understand the model of the data and the version, and who has access to that data. And so these are the kinds of improvements we've built, and then reach out to your team and let's see how you've applied them. Going forward, I know this is a bit of a busy slide, but we're getting busier. The team is picking up a velocity and the amount of work we're doing as we actually migrate the system over at the same time. As you can see here, we're currently shipping in this particular half of the year a slew of improvements. Again, more regulatory standards, updates to MIPS, more updates to clinical standards that you'll see directly into those workflows, in our EHR. Provider portal is getting a slew of updates, and I'll actually call out in care management, we're also doing a variety of things like allowing you to use readmission score IDs to prioritize who are the high-risk patients that you should pay attention to and get them in because they'll drive the highest cost. Across all the analytics platform, more query builder support for those of you that has told us you want to customize your analytics easily, and more analytics on cost utilization as you try to figure out how to squeeze all of the efficiency you can out of, again, any value-based arrangement you're in, or how to just effectively deliver more efficient fee for service. We're open for any business model. As you can see, looking ahead, and again, this velocity will increase as we go. Reach out to our team or your account team. Help us shape this roadmap. Give us feedback. But here are the top things we've heard from you in the community. Diagnosis insight is fast and getting faster. We're making orders of magnitudes improvement on that. We're going to release ECQMs for this reporting year, so you can be on top of that and ahead of that wave. Care management will continue getting better and more integrated with enhanced billing. You'll see additional risk scores coming out, and a big one, you'll see us launch our health data warehouse, health analytics warehouse. This is a very big release. You're going to see a lot of integration and unification when we do that on our own platform. For the existing customers that typically ask, okay, great, I love all that code, I love all those new features, but tell me a little bit about the infrastructure and your plans because I'm hearing about it. Well, the good news is I have to tell you, this is on us, not on you, but we will be very transparent about what we're doing. Today, this system runs on another cloud. We're currently moving it over to OCI. We will take care of, pay for all of the migration, including and up to the custom analytics that you and your team have built. This is a bit of the roadmap you can expect. Every customer will get a personalized migration guide, so you know when your services are being migrated, applications and data are being migrated, what to look for just to make sure things have gone well, and we'll give you all the places to file support tickets or people to call or just simply conversations to have to prepare you and your team. We do expect everybody to be fully moved over by the end of next year. All right. At this time, what I'd like to do is take a surprise, and we want to do a demo. We want to show you some of the great work on that services team and care management that we're doing to automate and scale care management teams. In this case, what the team has done is went out and talked to a bunch of care managers, and we're hearing your feedback, we're hearing your pain points, and we're simply hearing that I've got a large caseload, I've got a large population of folks that need attention, and I need help scaling. I want to reach out to more folks. I want to build more personalized outreach and personalized relationships. We've taken the latest and greatest technology, just happens to be generative AI, and we're using that to summarize someone's long record in their situation. So, as opposed to a care manager having to read maybe up to 40 pages of text and spend over 25 minutes preparing just to make a phone call, we've now reduced that down to a very short amount of text and a very short amount of prep time. What I'm going to do is hand it over to Janet Patello, the product leader for our health data intelligence care management team. Take it away, Janet. Thank you.
Thank you for the setup, Nino. What we see here is the newly imagined population app where all of our population health solutions are embedded tabs up top. As a care manager or care management supervisor, I would navigate to the care coordination tab, which brings me to my care management landing page. Now, as a care management supervisor, I see my personalized analytics dashboard, the list of care management cases by status aligned to me, as well as all of the care managers that I oversee. On top of analytics, we are also taking a prescriptive route. So that means surfacing next best action for the right person at the right time. Here, I have a personalized insight that suggests leveraging personalized outreach messages to help increase care management enrollment for cardiac patients. This corresponds with my low cardiac enrollment stat, where we are actually down 6% month over month. Initiating on this insight will pull up a list of potential candidates that qualify for our cardiac care management program. After reviewing this list, I decide to generate the personalized messages for outreach to the patients on this list, inviting them to enroll in our care management program. This is achieved by leveraging our GenAI capabilities to summarize the patient's longitudinal record and social determinants of health to produce a highly personalized, hypercontextual, and empathetic message to foster a deeper connection between care manager and patient from the get-go. The first patient on my list is Martin Fogarty, a 66-year-old male patient who was recently admitted to the emergency department at Baseline West Medical Center on September 15, 2023, for symptoms of heart failure. Additionally, I can see more details around his diagnosis, medications prescribed, and perhaps more importantly, his social determinants of health. We know the adage, treat the patient, not the disease, but we truly believe that we need to go beyond that and care for the human being. To do that, we need to understand what their psychological status is, the social constraints and barriers such as lack of transportation or food insecurity, in order to personalize a care plan for them that they can realistically adhere to and progress towards health betterment. To that point, I can see that Martin is a widower whose spouse passed away 4 years ago from cancer, and sadly, his son also passed away from cancer 2 months ago. Martin is very depressed and rarely leaves the house, living a sedentary lifestyle, with most meals being takeout or delivery. Our personalized outreach message addresses and connects with Martin as a human being first and foremost. We acknowledge that he is going through a difficult time due to his losses. We also understand that what he experienced can make it very difficult to focus on his own health and well-being, but we would like to try to help. And here is what we can offer with our care management program, and this is how I can help as his care manager. Now, this is that connection between care manager and patient that will help drive better adherence to care plans and improved patient outcomes. This is making sure we approach healthcare with humanity and empathy. Back to you, Nino.
Thanks, Janet. Well, everyone, thank you for letting us take you through the health data intelligence effort, and we look forward to more as we go. Okay, back to you, Nasim.
Thank you, Nino and team, for all your great work developing and growing the Oracle Population Health Platform. I'm excited about the team's accomplishments to date and their relentless dedication to democratizing data, propelling us towards a future of equitable and inclusive healthcare. Let's continue the conversation by focusing on our mission to accelerate the discovery, development, and deployment of extraordinary therapeutics by harnessing the power of everyday healthcare. I'm of course talking about the Oracle Learning Health Network, otherwise known as the LHN. The Learning Health Network helps health systems easily and efficiently participate in research, gain health insights, and guide care. We have created a network of health systems linked on a common data platform, enabling them to power efficient, and higher quality clinical research while supporting researchers with access to de-identified research data with data privacy protections. We believe the Learning Health Network can help revolutionize research by proactively identifying patients who could benefit and expediting time to recruitment and resulting for life-saving therapies. With Cerner's integration into Oracle, we are hearing strong interest across the healthcare industry to securely and safely activate reciprocal data usage for clinical research. Making this easier for all of our customers is a top priority. Starting January 1st, LHN membership will be included in all new contracts and renewals, with the sole focus of accelerating the global growth of the LHN and the power and responsibility we collectively have to improve care. Our plan is for the LHN to become global in 2024. Initial discussions are already in process throughout Europe and the Middle East. Additionally, we will be expanding LHN membership beyond Oracle Health customers to broaden our ability to integrate clinical research into clinical care. So what does this mean for the users of the LHN? Let's discuss this with Dr. Louis Ekwe-Ramoifa, Director of Computational Research at Children's Hospital Orange County, and the Vice Chair of the LHN Strategic Advisory Council. Welcome, Louis. It is so great to have you here.
Thank you very much. It's a pleasure to be here.
Wonderful. Louis, you are such a prolific publisher, leveraging Oracle's EHR real-world data. You have published in Nature. You were just named by Elsevier in 2022 as having the top paper. Tell me, what does having this type of access to real-world data mean for the work that you do?
Thank you very much for the kind words. One of the greatest challenge a data scientist or team of statisticians face when they are integrated within a hospital is simply the access to their own data. We're not talking multi-center now, we're just simply saying the data generated within the hospital itself. But with the Oracle EHR real-world data, all of that's solved in the context of the multi-center and in this particular case, national scale data. What I mean by that is with the Oracle EHR real-world data, researchers can now have access to data spanning the entire nation. I believe that's over 42 states and DC. And they have access to the tools they need. And these tools are the state-of-the-art tools in data science. So this accelerates research and application of data science within organizations while they build their internal structure. So one of the most beautiful things that has happened in my career is the creation and the management of the Oracle EHR real-world data, because it's accelerated my ability and my team's ability to do research.
That's wonderful. Many of our health systems using Oracle's EHR real-world data have been leveraging it to drive clinical outcomes. Can you talk to us a little bit about how you have leveraged it to deliver clinical outcomes?
Right. So one of the baseline in terms of scientific contribution is being able to provide incremental addition to literature, to knowledge. And that we've achieved with the papers that we've come up with. And these papers do not just lie there. We've received feedback from the community and other healthcare organizations reaching out to us to find ways to disseminate even further the work we've done. Now, beyond research finding and beyond understanding the medicine itself, one thing that we've been able to do also is learn from the data to inform local decisions within our EHR system. This includes findings that helped us refine our readmissions model, and the deployment of our readmissions model together with the wonderful work the team's already been doing in interventions, has seen the organization that I work with reduce readmission rates significantly and have sustained that reduction over a number of years. So what that entails is from basic science, incremental knowledge to literature, better understanding of events, for example, the COVID pandemic, to actually developing tools that are integrated as decision support tools within the EMR. So this has been one of the most fascinating enhancement of one's ability to do research here in the United States. So thank you.
You know, Louis, considering that only 20% of clinical research is done on the pediatrics population, this is really impactful work. And I have to say, as a parent, I'm truly grateful for the work that you and the team are leading. So I would be remiss if I did not ask you, with everything that's going on in AI and ML, what makes you most excited as you think about the implications of this with the use of Oracle's EHR real-world data?
Thank you very much. It is indeed a very exciting time, and with the advent and improvements in machine learning, AI, generative AI, and so on and so forth, what gets me really excited is giving Oracle EHR real-world data, and given that we have multiple teams, hospitals, academic centers that have access to this data, we're now able to do more of collaborative data science work, wherein people from different regions of the country can collaborate on a specific question and have exactly the same data set and a powerful data set as the Oracle real-world data. So my hope is that these organizations working together with Oracle Health can continue the path towards collaborative science. There's so much an individual organization or an individual can do, but there's so much more we can do as a community.
I couldn't agree more, Louis. And it all ties in very nicely to my sentiment coming out of Nino's presentation around democratizing data and helping drive health equity. Together, we have the power and responsibility to improve health and care across the world. That is the calling of this generation of healthcare leaders, clinicians, and caregivers. It is a true privilege to be on this journey with you all. As we wrap, continue to ask your questions and provide feedback in the Q&A feature, as it will remain open. To learn more about each of the topics discussed, check your event email or visit our website at oracle.com/health. I'll close today with the same words that Mike Cecilia, Executive Vice President of Oracle Global Industries, used in our first Inside Access. Our past has shaped us, our present is refining us, but our vision for the future is what truly drives us. We appreciate your faith, your patience, and your partnership. Together, we will continue to shape a better future for healthcare. For all of our speakers and guests today, thank you for joining us. Stay tuned for details on January's edition of Oracle Health Inside Access. Have a great day.